Are you getting ready for Medicare in 2025, or like me, have you been on Medicare for a few years? Hi, I'm Jim and I was retired. I'm about 68 right now, and I've been on Medicare for about 3 years. And in this past few videos, I've been presenting a DIY retiree's guide to Medicare. And in this week, I'm going to cover 4 big changes to Medicare and You in 2025. Stay tuned. So this week I got an email from Medicare announcing the new annual guide, which typically arrives around this time of year, except this time it comes electronically. Just a few years ago, my father-in-law would get a big tome every year and ask me to read it and let him know what's new. So let's start with the what's new and important on page 2 of the new guide. Lowering your prescription drug costs. Because of President Biden's new prescription drug law, in 2025, your yearly out-of-pocket drug costs will be capped at $2,000. Now that sounds like the first big change in 2025. Let's just review the facts. Very few of us on Medicare will spend that much out of pocket for prescription drug plans. I'm on several preferred generics in Tier 1, and I pay nothing beyond my monthly premiums for those drugs. The cost of these generics don't even go toward the maximum annual Part D deductible of $545. By the way, in 2025, the maximum annual Part D deductible will be more than 8% higher, or $590 compared to the $545. But if you are shopping for your Part D plan each year based on the total projected drug costs and your premiums, you will know if you need to even worry about this deductible. And now the second big change in 2025 is buried in the details. With the new lower out-of-pocket level, Medicare is eliminating the so-called donut hole, which affected few but confused so many. Now I put some links down below to some research that I've done on the changes for Medicare prescription drug plans, including the phase-out of the donut hole. Now here's how Boomer Benefits describes it. Once you and your insurance company have spent a total of $5,030 in 2024, you will move into the Medicare donut hole. In 2024, you pay 25% of the cost of your prescriptions, both brand name and generic, in this stage. So if you had a certain medication that cost $100 and you were paying a Tier 3 copay of $46 before the donut hole, that same medication would now cost you $25 in the gap. However, if that $100 drug were in a Tier 2 and you were paying $10 copay prior to the coverage gap, then you'd now be paying $25 during the coverage gap. Is that clear? Well, the truth is that so few of us will spend enough to hit the donut hole this year, the last year that it will be around, or even the $2,000 out of pocket next year. There are about 53 million enrolled in Part D plans, including nearly 23 million in standalone plans and 30 million in Medicare Advantage plans with Part D plans. This is according to the Kaiser Family Foundation. Now, their work suggests about 3% of them will have more than $2,000 in out-of-pocket expenses. These few Medicare enrollees will be glad that they don't have to worry about a donut hole, and they'll be glad with a new lower cap. But I fear that the other 97% will be paying for it in higher premiums, especially if you don't shop around this year for your Part D coverage. Now, when you dig deeper into this Medicare and You guide, you find that the maximum $2,000 out-of-pocket includes some extra help for those in low income, since the out-of-pocket will include certain payments other people and entities make. Now, and if that's you, and you get extra help, please be sure to use your state's SHIP counselors to coordinate the best decisions for you this fall. Now, this Medicare prescription payment plan is my third big change for 2025. Starting in 2025, you can help manage out-of-pocket expenses by spreading them out across the calendar year. But note, this payment option might help you manage your expenses, but it doesn't save you money or lower your drug costs. Let's see how this works. So let's go to this. What's the Medicare prescription payment plan? And there's a short video here that'll describe it, and it notes that that all plans must offer this payment option. Participation is voluntary, and then they give you some choices of what to know before participating. Will this payment option help me? And what to know if I'm participating already. So let's just, will this payment option help me? Click here, and it first asks you, are you getting any help paying for drugs? So I'll say no. And is your annual income less than these levels here? And I'll say no. And then, how would you describe your drug costs each month? My drug costs are consistent and affordable. My drug costs change each month. My drug costs are unaffordable each month. And let me just hit this one first. And then they ask you, do you think your out-of-pocket costs yearly are going to be more than $2,000? And let's say you're one of those 3%. And when do you think you'll hit that? And I'll say before. Then yes, this payment option might help you. But let's start over and let's answer after. Then this payment option might not help you. Now, this time, let's say that drug costs are unpredictable and random, like our utility bills, for instance, but they're not usually more than $2,000. So this payment option probably won't help you. This payment plan is sort of like the utility bill plans that allow you to spread out payments throughout the year rather than pay more during the cold winters or hot summers. When my insurance company offered me something like that, I declined because why would I want to send someone else my money, extra money, in 1 month just so that my bills were smoothed out throughout the year? Hey, before I go any further, please like and subscribe to this channel and hit that bell if you like entertaining ideas from a DIY retiree. It'll help this channel appear higher in the search algorithm. Now, the fourth big change I found in the book is this one: limits on Medicare coverage for telehealth services. During the pandemic, rules were loosened to allow your doctor to visit your home virtually through audio and visual technology. And that visit was covered by Medicare. Well, those relaxed rules are ending on December 31st, 2024. That big change was on the bottom of page 2, changes to telehealth coverage, and it may matter to you. Now, during the pandemic, telehealth services increased to more than 30% of Part B services. But in 2021 and 2023, telehealth dropped to about 10%. But that's still twice the level it was before the pandemic of about 5%. Deeper in the book, you learn that this period of relaxed rules during the pandemic will end, and after, in 2025, you must be in an office or a medical facility located in a rural area to get telehealth services. And the exceptions will include some monthly end-stage renal visits for home dialysis, some services for the diagnosis and treatment and evaluation of an acute stroke, some services to treat substance disorders and co-occurring mental disorders. But generally, telehealth services are going to be severely curtailed in 2025. Now, there are some legislative proposals to continue the relaxed rules on telehealth, but there is clearly a worry that too much telehealth would likely lead to added costs for Medicare without as much control as if it's in the office or a facility. So how about you? Do you want to see more services over the computer screen, or is getting rid of the pandemic rules a good thing? Leave me a comment below with your thoughts. While telehealth might be curtailed, Medicare clearly wants us to use some digital pathways to serve you better. You can get your Medicare and You 2025 electronically now. There's no need to request a mail copy. Clicking that email takes you straight here to Medicare and You, and you have the choice of getting the handbook as a PDF, or if you want to acknowledge, log into your account and sign up for the e-handbook every year. But as this message on Facebook recently noted, you can't escape some paper. Every month, Medicare needlessly mails me premium statements via United States Postal Service. My Medicare premium payments are automated using Medicare's Easy Pay program. Yet Don notes that even if you have all your communication settings for electronic, you still get this monthly confirmation statement. Well, I was wondering the same thing, Don. Maybe Elon Musk can form a committee or something to look into waste and inefficiency in government. I will conclude with my standard warning. I am not a professional planner or an insurance professional. I have no initials after my name, so take these as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need one.